Well, good afternoon and welcome. This is our second lunchtime webinar, and we have our wonderful aesthetic crew here. And of course, I'm Dr. Foley. A lot of you know who I am. And we have Ms. Gabby, our advanced laser esthetician, who's going to be doing our wonderful webinar today, along with our lovely Amy, who's our radio frequency technician, and Stevie, who you all know and love here in the office, who gets to do the fun stuff at the end. That's the prizes. That's why you got to stay to the end. And we want to be aware of your time. So we want to be cognizant of that. So we will keep this to a half an hour tops. So that way, if you're eating your lunch, that's good. Please keep eating away. And if you have questions throughout, just feel free to go down to the bar where it says the chat. I believe, yeah, that chat button. It's down and to your left. And you can chat, little questions to us, and we'll try to answer those throughout the webinar. Today, it's all about 3-4-Me, and 3-4-Me is just some fabulous things that we can do to not only help the ocular surface feel better, because that little bit of IPL goes a long way, but I'm going to have Gabby explain the wonderful things about 3-4-Me, and I have had a treatment, and it is fabulous, and I really love it. And I'm going to let Gabby take it away.
All right. So let's see. Let's get this bad boy started. There we go. Okay. So 3-4-Me is kind of the all-around treatment where you're going to get some dry eye benefits from the IPL portion of it, but you're also going to get a lot of the benefits that people have been asking me, does IPL help with? And yes, but not to the extent that 3-4-Me helps. So this is kind of the all around everything that you can possibly want all in one package. It's the brighter solution for dull skin. As we age, we start to lose collagen, elastin, and all the things that keep it nice and vibrant and tight and all the things that we want. And we start just losing it and not producing it as quickly. With 1540, which is the new component to 3-4-Me that we're not quite used to with IPL, we are actually going to be getting more of that collagen and elastin production by targeting water in the skin that causes kind of a healing effect that allows us to kick that into gear. So what exactly is 3-4-Me? It is a kind of two-step treatment where you start with IPL for the sun damage and facial veins or that redness that you get. Some people get it right around the nose over here, some people on the cheeks and chin, forehead. So it's taking care of all of that like we're used to with IPL, but it also is going to attack those wrinkles. It's going to get any fine lines, deeper wrinkles, things like that with a deeper treatment with the 1540. So we're targeting kind of everything that we can in one treatment. So we don't have to have you come in, say, for an IPL every month for 6 months right here and there. And then you come in for 1540s afterwards to do the rest of the things you wanted. Instead, it's more like 3 treatments, get it all done at once over the next 3 months, and then you're happy and you got everything you wanted. So again, we start with IPL, and that's where we target the redness, the browns, we do all of that. People that have had dry eye treatments are probably used to this process already. So we do all of that, just that single pass on the face. Afterwards, I ice the skin down, make you a lot more comfortable because as we know, our face feels pretty warm and kind of sunburnt after IPL. And then we go right into the 1540 laser, which is a different handpiece that some of you might not be so familiar with. It is a fractional non-ablative resurfacing laser. So that's a lot of words, but basically it means that yes, you're gonna be a little pink, maybe even a little bit of swelling, but it's going to go a bunch of little tiny micro laser beams going to that part of the skin that activates that collagen and elastin. So this part's kind of a lie. Minimal discomfort is not the best. Dr. Foley is a beast when getting treatments, and so she makes it seem like it's super easy. I do really like using the cooling little handpiece that we have just to help cool down the face as we keep on going. It makes it a whole lot easier. There are also some people like to use topical numbing. That's one of the things where it is up to you. If you have a lot of reds in the skin, I tend to stay away from that option, because what topical numbing cream does is it kind of constricts those blood vessels, makes it really hard to target that redness. So if you have more of an issue of you have freckling, aging, the brown dark spots, and you also want to get some of that anti-aging with the fine lines and wrinkles, numbing can be a great option. Otherwise, if your main concern is redness and then fine lines and wrinkles, I would advise against it. And I will say it feels pretty similar with or without. It's very close in sensation. Same thing with IPL or regular 1540. You'll have a little bit of redness. Like, I wouldn't suggest having a hot date right afterwards. Otherwise, by the next day, again, you might have some areas that are a little splotchy, but nothing crazy where if you went to the grocery store, anyone's going to be staring at your face saying, what the heck is wrong with them? It's really nothing too crazy. You will feel that sunburn sensation afterwards. Again, what to expect. So immediately post, if you have any of those little facial veins right through here, those disappear quite quickly. If there's a large one, sometimes they turn a little bit more purpley, and then they'll take about a week or so to go away. Think of it kind of like a bruise where we're breaking up that blood vessel and then it's slowly just healing. Brown spots will flake off again in 1 to 3 weeks, just like IPL, where they will darken up a little bit at first, and then they will either lighten up or they will kind of flake off by themselves. And then the fine lines and wrinkles. So collagen and elastin production hits its like peak at 3 to 6 months. So I always tell people this is the last thing you're going to notice. If you had 3 of the ThreeForMe treatments, then you will start to notice by your last treatment, like, I'm starting to see a little bit, and then I'll keep on getting better and better over the next 6 months. Great thing to keep in mind is that it is super safe. We have our melanin reader, the skin tell, that we tap to the face to see how much pigment you have in the skin. That is a big one to make sure that we treat you safely and effectively. It's also quick, about 45 minutes for a treatment. So, I would not suggest doing this on your lunch break, but if you work from home, you could. I wouldn't want to go back to an office afterwards, though. Yeah. It's also convenient. I mean, you only need 3 of these treatments. That's the beauty of it. And some people can even get away with less. So it's really just, you pop in once a month for 3 months and you are all done. So here are some of the results that we're looking at. So even this is just one treatment. You can see a pretty great reduction of pigmentation, as well as some of the lines that she had through right here, her smile lines. Overall, I think it looks really great for just one treatment that she came in for 30, 45 minutes in office, and we got that for her. And you can see this is after 2.5 months. So this is getting closer to that 3 months of the collagen and elastin growth in the skin. So it gave it a little extra time. You're not going to see it immediately looking plumper and juicier skin. Again, one treatment after 2.5 months. And this, you can even see, it looks like she had some kind of maybe acne, some kind of texture on her cheeks that were red that we helped to take care of, as well as some freckles. So definitely lighten those up. And overall, it looks like forehead got just a little bit kind of tauter, but I mean, again, for pigmentation with one treatment, that is awesome. This one blew my mind, but I also think there might be a little bit of a smile. So I was really just looking at the forehead here and the under eyes, because right here, I don't want to judge too much because it looks like that's a little bit different. This is after 4 treatments, and it looks fantastic. She didn't have too much pigmentation. You can see a little bit of flushing through the cheeks that she definitely got a lot of good results on that, as well as a little bit of kind of that redness right through here on the forehead. Otherwise, though, I mean, as far as fine lines, wrinkles, got really great results. This one also kind of blows my mind. This is the general 3 treatments, so the ThreeForMe, where just all the dark spots got taken care of. And there is a good reduction of lines on the forehead and kind of around the eye, under eye. and she's still like, she's looking her age, but she looks so gracefully her age where it just kind of, it turned the clock back a little bit and it looks fantastic. All right, so frequently asked questions. If you're a candidate, basically, if you're a candidate for IPL, you're a candidate for 3For Me. So if you've done the dry eye treatments, fantastic. Another thing to keep in mind is basically skin tone. So if you're super duper tan, this is something we want to avoid, maybe until winter. Things like that. If you have a pacemaker, we can't do this. And if you had like a metal plate in your skull or a pin or something like that, this is not something that we'd want to do. And then, the person that's going to get the most from this treatment is going to be someone that has a combination of redness, dark spots, and fine lines and wrinkles. Is it safe? Of course it is, or else we wouldn't be doing it. And then how many treatments? It's 1 to 3. 3 is my sweet spot that I like for people. All right. Takes about 45 minutes. Minimal discomfort. It really feels different for everyone, but we go at your own pace. And then how long can you resume normal activities? Anything like hot tub saunas and like vigorous exercise, that is regular daily activity for you. First off, I'm jealous of your hot tub or sauna. But second off, that's not something that we want to incorporate. So anything that heats up your face, we want to avoid. No sunbathing or anything like that. During the series, you really want to avoid sun exposure on your face. So sunscreen is your best friend. But otherwise, no trips to the lake or the river right after a treatment. You want to take it easy at home, stay in the shade. Otherwise, by the day after, you should be able to go out in public without anyone looking at you weird. So it doesn't have to be anything too crazy. I would give yourself that day and night kind of after the treatment to just relax, use an ice pack, just kind of let your face be a little sunburnt and angry at you, because it feels warm and you don't even want to go out with it feeling like that anyways. All right. And then as easy as 1, 2, and 3For Me. I like that.
That's cute. Awesome.
That was
very cute. Well, I can just say from what my experience was that we went after a couple of lovely pigment spots because I grew up in Southern California with a pool. Yay. And all we did was baby oil and Saint-Tropez tan, stuff. And so I had a lot of sun exposure on my face. And so we're going after that because that's all precancerous stuff, right? And we want to eliminate that from my risk. And of course, I'm not a spring chicken. So anything else that helps with the glow, I'm very happy about that now. So I can attest that, getting rid of the dark pigments and then dealing with some of the rosacea, which helps. I've really noticed my eyes just feeling fantastic. Just limpid pools. I feel like I can do the stare down with my patients really well now. And then the third thing that I noticed is that the 1540 after that, it wasn't that bad. You did such a great job, Gabby, of cooling it down and made it very comfortable. Yes, I do have a pretty good pain tolerance.
And I could be dramatic because I have the worst pain tolerance. So that we have 2 ends of the spectrum here, where if you're somewhere in between us, you're most likely fine.
Yeah.
We do have a question from Terry. So she said, Dr. Foley for the eyes and Gabby for the skin. How does 3For Me compare and contrast with your microneedling? And do you want me to take this or you to take it?
I'm going to let you take that one. I think you're better on that.
So for me, if you have ocular rosacea, 3For Me is a better option. If you're looking at just kind of thickening up that skin around the eyes, really you can go either way. They're both going to help with collagen. And I kind of like to say 1540 and microneedling by themselves are very similar. It's kind of what I choose. If you have a darker skin tone, I might say, let's do microneedling instead. Let's not put a laser heat on that. But if you had ocular rosacea, plus you need a little bit of tight, collagen and things like that around the eyes, 3For Me might be our best option because it does help cut out that rosacea component. So it kind of depends on what things you need to work on with your eyes.
Yeah, and we did it at the end of clinic on a Tuesday, and I was back early 6:30 in the morning on Wednesday, and it was fine. I just made sure I had moisturizer and sunscreen on. It felt great. It felt really great.
We have another question.
Yeah.
Does the 1540 go deeper than microneedling?
Not necessarily. With microneedling, you change the depth of the needle anywhere from, 0.5 millimeters to 2.5 millimeters, which is not very common. But so it really depends on your skin's thickness in general. For some people like me, I used a lot of topical steroids on my skin when I was younger because I am an eczema girl, and I didn't figure it out till later that it's thinning out my skin. So even now, it takes a really long time for me to kind of work my skin up to deeper microneedling. 1540, it hits the water in the skin, which basically what happens is that water vaporizes and then it causes this injury to the face, just like microneedling, where they both say, hey, there's an injury, body, come heal the face. And that's what activates that collagen and elastin. So not necessarily, it's more about that micro injury where the face is healing it. Just to confirm, the ThreeForMe is better for rosacea. IPL, that would be my number one for rosacea if you just had rosacea. If there's other things that you want to also work on, ThreeForMe is great as well. But for rosacea only, let's focus with IPL.
Okay, I think that sounds great. All right, gosh, these have been great questions. Boy, these lunchtime folks are really on their game. First of our evening, I think everyone's just falling asleep drinking their margaritas. Okay, good. This is great. Any other questions people have for us? Because this is your time, because Gabby is the expert here.
Gabby, I do have a question. After these treatments, so say you have it done on a Friday, can you go out like Saturday as long as you have your sunscreen to the lake, or should you cover your face with a hat? Like
So, it really depends on the UV index. Like if it's a day like today where maybe the suns are peeking out of the clouds a little bit, you're probably fine with just sunscreen. But in the summer, I would say sunscreen, big floppy hat, hang out in the shade with, keep your face out of the sun. For one, I guess if you had it done Friday and you go in Saturday, or you go to the sun Saturday, you probably won't feel that sunburn sensation anymore. But you definitely don't want your face in direct sunlight, even with sunscreen on right afterwards. And you will feel the difference. Like it'll feel really hot within maybe 10 minutes versus maybe you take a couple hours of sunburn normally. It'll feel a lot different.
And plus, we should be wearing sunscreen every day, right? If we don't want our skin to age quickly, we go after Amy all the time about this. But it trust me, for my years, way too many in the sun, I beg all of you not to do what I did, and I wish I could turn back time like Cher. I really do. But I'm paying for the price now.
Tiffany makes a really good point. Also, sun reflecting off the water. Yes. And if you go to the ski slopes, yes, all of that is reflecting, bouncing back up to you. So really good point there. I've had someone that she, went fishing all the time, and she would wear a mask underneath her hat. And at first I was like, why are you wearing a mask like while going fishing? And she's like, because I will sunburn right here, when she went fishing with, her dad, and she would go out. And so that's another good point, is that to do the sunglasses. And, I don't expect people to wear a mask during summer, but if you're, if you're fishing all day, think about it. Terry asked, how about product use before and after a ThreeForMe treatment? Things like retinol, etc. Same thing with IPL. You want to wait at least 2 weeks between retinol and treatments. So you want to be off retinol for 2 weeks prior to an IPL or 3ForMe treatment, or 1540, any of these laser treatments. And you want to wait 2 weeks after to start using it again. How often should we redo IPL? If you're talking about touch-ups, it depends. If you're doing it just for ocular surface, ocular rosacea, that's more Dr. Foley's territory. As far as if you have redness, dark spots, things like that, The aesthetic range for the skin is normally every 6 months. Someone that has really severe rosacea, they may even see me every 3 to 4 months. So it really depends on severity, but if it's for the eyes, that's Dr. Foley's territory.
That's where we determine your ocular surface checks, how often we should do it. Is it once a year or once every 6 months? But I think it's just like Gabby. We have a few people who have to come in every 3 to 4 months because their facial rosacea is so intense. It keeps firing up the ocular rosacea. So just think of it as a deep, nasty root of a weed, and we have to get to the root cause of the rosacea. And some people just have ocular, they don't have any facial, but the majority have both. So that's why we have to treat both.
We do have somebody asking for the cost for one treatment. If you want to know, your best bet is just to call and talk to Stevie. She can answer all the money questions for you.
Yeah, because I think it depends on a bunch of different factors, right, Stevie? Where we're doing it, what areas, all that good stuff.
Well,
I know.
Do they need to do a consult before they do these, Gabby?
Absolutely.
I would definitely recommend that. If like someone that's had a bunch of IPL, like there's some people in this chat that I see, I'm like, yeah, I know who you are. There's some people that if Stevie was like, hey, this person's scheduled for a consult, I'd be like, no, just schedule them. But if it's been a while since you've had an IPL treatment, or you want to know more about 1540 and you're like, no, like I want to consult one-on-one, definitely. So if you've never had a laser treatment at all, if it's been a while since one, yes, we're going to do a consult.
Terry would like to know, is 3ForMe appropriate for the neck too?
Oh yeah. Neck, deck.
I want that next.
All of this.
Gotta have this look like this now. It's like, oh my God, now all I do is look at people's necks. This is terrible. Terrible. They got a mess. Yeah, sorry.
Well, because we don't see anything. I mean, here, all we see is this and this. We're like,
well, we're doing a special shout out this month for a neck product. And so we'll be really excited to share that with you guys.
Yeah. Mm-hmm. Yeah, and it's good. I do use it just because I'm realizing, dang, yeah. And so I need to get back to Gabby on that too. All right.
It's about that time. I think we should hop into prizes.
I think that sounds great. Okay, Stevie, this is when I wish we had some really cool music. We've got 2 prizes. You want to discuss what those are?
Yes, one is the Citrus Serenity that you apply on. You want to use these twice a day, morning and evening. Apply the Citrus Serenity and then apply the neck and neck. I believe it's 2 months. You'll see a drastic change. It'll change your world. So that we are giving away to one winner tonight. So I'll drop that right now. This is always so nerve-wracking to me because people hate me if I don't call them. They hate me. Okay, so Tiffany J, you have won the neck and deck and Citrus Serenity.
Yay. And I will say with the Citrus Serenity, that's an antioxidant. So if you can also use that one on your face, only use it as a morning serum. On the neck, you would apply it morning and night, and then do the neck and deck on top of that, kind of like a moisturizer. And that's where you can get that really good tightening result, which we do somewhere on our blog, somewhere back. It's hidden in there. We couldn't find it. There's a before and after somewhere there.
Mm-hmm.
So
it's amazing.
If you're a super fan and you
just
find
a reminder, you can use this. You can go all the way down into your décolleté. It really does work really good together. These together are like the miracle drug.
Oh yeah.
It's awesome.
And yes, that's really.
Dr. Foley, can you unmute yourself and say that again, please?
I know. I think she's
sorry.
muted.
So no, since I grew up by a pool, remember, and we only wore bikinis back in the day. I don't know if I'd be doing that now, but yeah, a lot of damage there, and started that yucky crinkling thing where I'm like, oh crap. And so yeah, I can attest that is gone, and I attest to it too, those 2 ingredients. So thank you. until I can have Gabby zap me away.
All
All
right. And
right.
we have one more prize. So don't leave us yet, you guys.
Yeah. Okay,
Okay.
so this is the grand prize. This is one ThreeForMe. So here is the grand prize. Okay. Gina M.
Gina. Yay!
All righty. And so just know that we have 20% off the ThreeForMe, either one or a package, which that can be a huge savings of hundreds and hundreds of dollars. So yeah.
We're
So
also doing 20% off Citrus Serenity and Neck and Deck Envy. So
Yes,
if
we
you
are.
want to go more the topical route, we can also do that.
sweet. Awesome.
And you'll get 20% off the ThreeForMe if I hear from you by Friday at close. And if you have to leave a message, that's fine. People are like, oh my gosh, they try to get a hold of me. What?
Gina says, pick someone else. I'm your Cynosure rep.
Okay, because I was like, I don't know who Gina
Are you
is.
sure, Gina?
Oh yeah. Okay, good.
Look at
Okay.
us.
All right. Karen. Who is she? Who
Karen.
she is it?
She's another
That's
rep.
great.
I know.
Is
I was
she
like, okay,
another
Karen,
rep?
are you a rep too?
No, I don't think so.
Okay.
I don't
No,
think
she's
so.
not.
Okay.
She actually
No.
just said thank you to everybody before we even drew her name. So that's
Aw.
ironic.
I didn't think Gina was
Congratulations
gonna
to all
be
the
here.
winners.
Okay, but if you call me, this week and leave me a message, that's good as gold. And people just get scared if they can't get a hold of me immediately and think that it's gone, but it's not gone. And they freak. And I'm like, I only have one phone.
Karen asked,
So-
what did I
Karen
win?
says,
I
"Did I
missed
win?"
something.
Did I miss something?
You
Yes,
won a
Karen, you won
treatment.
a free ThreeForMe treatment.
Worth $1,000, by the way.
All
Which-
good.
Yeah, she'll have to reach out to us because we don't have her last name. So
Nope. I know you're gonna have to call me soon. My phone's going ballistic right now. Are you calling right now? Okay.
All right, you wonderful people. We appreciate you all being here today. Remember, next month we have another one, the last Tuesday of every month from 12:15 to 12:45. We want to respect your time. And again, Gabby's going to be giving us some insight. You want to give them a little heads up of what next month?
So
lovely
next
thing
month,
is gonna be?
this is for the makeup girls. If you like mineral makeup, we're doing our mineral air. It's that airbrush foundation. That's what we're doing next month. For, even if you're not good at makeup, I'm terrible at makeup and I'm still able to do the mineral air. So it's very user friendly, great for
Very,
all skin
very
types.
easy to use.
I have a friend that has acne. She gets awesome coverage from it. My mom uses it, which, I mean, to be fair, her skin looks great, but I have so many people using it and it looks fantastic on all of them.
It also, for those of us that have to wear a mask, it doesn't absorb into the mask,
Mhm.
and it's very safe and non-toxic to the eyes, which of course is the most
And it
important
has
thing.
skin benefits, which it basically is adding on to your skincare routine. So it's like good for you to put on makeup. So that'll be
There you
next
go.
month.
All right. Well, thank you
Stevie.
everyone for joining us. We will
Karen
have this
sent in her
recorded.
last name. I'll let you know when we're done.
Okay. And that way we will have it up boosted onto the website, hopefully in the next day or two. So if you want to re-look at this and re-listen again, you can, and you can go back and see some of our other crazy episodes that we've had with our dynamic, group here, our aesthetic team. All right. Thank you, everyone. Have a fabulous
Thank you, guys.
Stay healthy. Bye.
Bye.